Welcome to the Medi Queries, your destination for the clear, reliable, and engaging pharmaceutical education. Whether you are a pharmacy student, healthcare profession, or a curious learner, we have got you covered. On this channel, we simply complex the drug formulations and make learning visually exciting. From dosage forms to the modern drug delivery systems, we explain it all in detail. If you found out videos helpful, don't forget to like, share, and subscribe. Now let's dive into the today's topic, suppositories. In this video, we will explore the suppositories, a unique class of the solid dosage forms. So they are designed to melt or dissolve inside the body cavities, releasing the medication for the local or the systemic actions. So unlike oral tablets, suppositories are helpful when a patient cannot swallow or take medications by mouth. So we will go through their types, so preparation methods, advantages, evaluation tests, and much more. So this topic is essential for the pharmacy students and forms a core concept in the pharmaceutics. So let's begin by understanding what suppositories actually are. A suppository is a medicated solid dosage form that is intended into the rectum, vagina, or urethra. So once inside the body cavity, it melts, softens, or dissolves at the body temperature. This allows the drug to be absorbed either locally or systemically, so depending upon the formulation. So the base plays a crucial role in the drug release, melting behaviors, and the patient comfort. So suppositories are used in conditions ranging from pain relief and infections to the constipation and the hormonal therapies. They are usually made using the molds and requires a careful formulation for dose accuracy here. So advantages of the suppositories. So suppositories offers several benefits over the conventional oral dosage forms. They are ideal for the patients who are vomiting, unconscious, or unable to swallow the tablets. So since rectal administration partially bypasses the liver metabolism, so the bioavailability of the some drugs improves here. Okay, so they reduces the gastrointestinal side effects caused by oral drugs like NSAIDs. So suppositories also provide the localized actions for the infections of the inflammations in the rectal and the vaginal areas. This mainly makes them especially useful in the pediatric, geriatric, and gynecological case. Okay, so all these are all the various advantages of the suppositories, and let us see the disadvantages of the suppositories. So despite their benefits, suppositories comes with limitations. So some patients found them uncomfortable or embarrassing to use, affecting compliances here. So their absorption can be unpredictable due to the variations in the body fluids or the presence of the fecal matters. Okay, suppositories made from the fatty materials like cocoa butter may melt in the warm climates without the refrigeration. Okay, so manufacturing requires precision to ensure the uniform drug distribution and the doses here. So also retention can be a problem if the patient express the doses prematurely here. Okay, so all these are all the some disadvantages of the suppositories, and next is the type of the suppositories. So suppositories are classified based on their site of application here, like rectal suppositories, vaginal suppositories, urethral suppositories, like that. So in case of rectal suppositories, they are torpedo shaped and inserted into the rectum for local or the systemic effects here. Whereas in case of vaginal suppositories, these are also called as pessaries, the oval shaped and used for the local treatments like infections. And next is the urethral suppositories. These are also called as boogies, are the pencil shaped and rarely used, so mainly for the male patients. Okay, and each type is designed to suit the anatomy of the cavity and ensures the proper drug delivery here. So choosing the correct type is crucial for achieving the pharmaceutical effectiveness here. Suppository bases. So, suppository bases are the foundation upon which the drug is incorporated. Okay, so they are essential for giving the suppository its shape, stability, and for controlling how the drug is released. So, the base must be non toxic, non irritant, and should melt and dissolve or disperse at the body temperatures here. Okay, so broadly these bases fall into two main categories, like oleaginous bases, that is fatty bases, and water soluble bases. So let's explore these two types in detail and understand their advantages, disadvantages, and applications here. So first one is oleaginous bases. These are also called as fatty bases. A good example for this is cocoa butter. So one of the most common oleaginous base is cocoa butter here, also known as theobromine oil. So it melts at body temperatures, providing a quick release of the drug once inserted. Okay, so it is a smooth, soothing, and a well tolerated, especially useful for the rectal administration here. However, it is sensitive to heat and can undergo polymorphic changes affecting its melting point. So cocoa butter is an ideal for heat sensitive drugs, but it requires a careful handling during the preparation here. And next one is the synthetic bases. For this examples are vitepsol and fatty base. So to overcome the cocoa butter's limitation, that is it is a synthetic fatty base like vitepsol or fatty bases, and suppositories are used here. So these are stable and having a uniform melting points and are less prone to the polymorphic transitions here. So they are pre-blended mixtures of fatty acid esters, often with emulsifier, offering the better consistency here. So the melt at body temperatures and provides an excellent drug release in rectal and vaginal use. So their uniformity and the resistance to the oxidation make them ideal for the industrial scale production here. So next one is the water soluble bases. Is the water soluble bases. Glycerinated gelatin is a water soluble base commonly used in the vaginal suppositories. It dissolves slowly in the mucosal secretions, allowing for the prolonged drug release here. Okay, however, it may cause some irritation to the rectal mucosa and must be stored in a airtight containers due to the moisture absorption here. It is not suitable for the heat liable drugs since it requires heating during preparation. So this base is excellent when a sustained release of drug action is desired here. And next one is the water soluble bases, that is polyethylene glycols. So polyethylene glycols are the synthetic polymers used in various combinations to form the suppository bases here. They are non-melting but dissolve slowly in the body fluids, allowing in a controlled drug release. So PEG suppositories do not require refrigeration and offers a good chemical stability here. So they can be irritating to the mucosal tissues, so formulation must be carefully adjusted here. PEG bases are preferred for drugs that requires precise, predictable dissolution, especially for vaginal or urethral use. So let's see some summary for this base selection. So choosing the right suppository base is crucial for the effective drug delivery here. So oleaginous bases like cocoa butter and synthetic fats are preferred for fast release and patient comfort. So whereas coming to the water soluble bases like PEGs and glycerinated gelatins are used when prolonged actions or a chemical stability is required. So factors such as drug solubility, intended site of administration, stability, and the patient preference influences the choice here. So understanding the properties of each base ensures a safe, effective, and a stable suppository formulation. Next one is the formulation of the suppositories. The formulation of suppository involves the combining in a suitable drug within a compatible basis to ensure the safe, effective, and the localized drug delivery. So key components includes the active pharmaceutical ingredient, that is the API, the suppository base like cocoa butter or PEG, and sometimes additives such as surfactants, preservatives or stabilizers. So the drug must be evenly dispersed or dissolved in the base to ensure the uniform dosage here. So the choice of the base depends on the site of administration, drug solubility, and desired release rates. Okay, so factors like melting point, viscosity, drug compatibility are carefully evaluated during the formulation here. So ultimately, a well formulated suppository must provide comfort to the patient, stability of the drug, and the efficacy in the delivery. Okay, so all these factors are needed to be considered while preparing the suppository here. So let us see the method of preparation of the suppositories. So suppositories can be prepared using three main methods. First one is the molding method, compression, that is cold compression method, and hand rolling method. Okay, so in molding method, it is a widely using method here. So that is the most common method where the drug is mixed with the melted base and poured into the molds. Okay, a single step procedure here. So next one is the compression method. It is used when the drug is sensitive to heat. So here powders are compressed into the molds using somewhat sort of a pressure. And next one is the hand rolling method. It is a traditional one and is used when a precision molds are unavailable. So though it's a less commonly used today. So each method requires an accurate weighing, uniform mixing, and a careful temperature control. Okay, finally the suppositories are cooled, removed from the mold, and checked for the uniformity before packing. Okay, so let us see the packing and the storage of the suppositories. A proper packing and the storage are crucial to maintain the integrity and the stability of the suppositories here. So they are usually packed in a aluminum foil, plastic shells, or a blister packs to protect from the moisture and the contamination. So oleaginous bases like cocoa butter requires refrigerated storage as they melt at room temperature. And PEG based suppositories, however, can be stored at room temperature, making them more convenient for the transportation. Okay, so labels must indicate that the storage conditions and the route of administration clearly. Okay, so protective packing not only maintains the shape but also ensures the patient safety and the product efficacy here. Okay, and next one is the uses and the application of the suppositories. So let us see some uses of this suppositories. So suppositories offers an invaluable alternative for the patient who cannot take oral medication here. Okay, so they can be used for the systemic effects like in treating nausea or pain, or for local actions such as in treating the hemorrhoids or the vaginal infections. So the route of administration includes rectal, vaginal, or urethral, depending upon the condition we can prefer. Okay, so they are particularly useful in the children's, elders, or unconscious patients where swallowing is difficult. Okay, at that time it is a wonderful route other than the oral route when the patient is not that much cooperative or not in a condition to take the medication orally. At that time we will approach this type of formulation. Okay, so the suppository bypasses the gastrointestinal tract and it also um, undergoes the first pass metabolism, so which requires the drug absorption in some cases. Okay, so their versatility make them important in hospitals, clinics, and home based treatments. Let us see the evaluation of the suppositories. The evaluation of the suppositories is crucial to ensure their safety, uniformity, and the therapeutic effectiveness here. First, the physical appearance is checked for any cracks, air bubbles, or deformation which could affect the drug release. So next, the weight variation test which mainly confirms whether each suppository contains a uniform amount of drug on the base here. Okay, and next one is the melting point or the liquefaction test. So is preferred to ensure the suppository melts or dissolves appropriately at the body temperature. Okay, and disintegration test which mainly measures how quickly the suppository breakdowns once administered, so which affects the drug absorption here. And finally the drug content uniformity and in vitro drug release test which mainly assess if the active ingredient is evenly distributed and released as expected. So together these tests guarantee that the suppository meets the quality standards and provides the reliable therapeutic actions here. And That brings us to the end of our detailed guide on the suppositories. So we have covered what they are, their advantages and types, and how they are made and their medical uses. Suppository continue to be critical option in the drug delivery, especially when a oral administration is not possible. Okay, so we hope this video helpful. You understand the topic in the depth. So if you enjoyed learning with us, please like, comment, and subscribe to Mary Queries for more. See you in the next video with another exciting pharmaceutical topic. Thank you.